Hi, I'm Dr. Ryan Bell. I'm going to be talking to you for a few minutes today about newborns and reflux. This is one of the most common questions that I get asked with new parents and new babies. First of all, it's a very normal thing for babies to reflux. Studies show about 70% of babies are going to be spitters to some degree or other. There's really not a difference between refluxing and vomiting. Just basically means whatever food, whatever stomach juice is coming up ends up being concerning for parents. So first thing as a pediatrician that I always look at and that we always worry about is we want to make sure your baby's still gaining weight. So it's important to do your regular checkups, do those visits, make sure that even though baby's losing a lot of food with spit up or reflux, that they're still able to gain adequate weight. The second thing that we worry about is reflux can sometimes be very painful. So if a baby's bringing up a lot of stomach acid, it hits the esophagus, it burns, it hurts. And babies will have the reflex of arching their back while they scream and cry, and it's pretty obvious that they're in pain. If it's just milk that they're swallowing and then is refluxed back up, it doesn't seem to hurt, it doesn't seem to bother them, food comes out. We put those babies in the happy spitter category, and we tend to not worry about them very much. So as long as babies are gaining weight and they don't seem like they're in a lot of pain, it's usually not a whole lot that we worry about or do for those babies. There are cases where there can be problems. So if babies are in a lot of pain, sometimes an antacid medicine has a role there. It's not going to stop the baby from refluxing, but it might reduce the acid that's coming up and hitting their esophagus. They'll be a lot more comfortable, and that reflux will be a lot more tolerable. Other times that we worry, a consistent projectile vomiting, if it literally shoots across the room and it's every time they eat, we worry about a condition called pyloric stenosis, which fortunately is pretty rare. But that's one to keep in mind when you're thinking about your baby and reflux. Things you can do to help. So there are a few things that you can do as a parent that will make a difference. One is try to keep the baby's head elevated to about a 30-degree angle. It doesn't have to be steep, but you don't want a baby laying flat where it's a lot easier for food to come back and forth from the stomach to the esophagus. Keeping your baby's head elevated is probably the first thing that I would recommend. Second is try not to overfeed your baby. So stomach has a limited capacity. Once it's full, if you continue to eat and it expands further, it gets angry and it will clamp down and shoot food back up the chute. Doing smaller feedings, even if you have to do them more frequently, can be really helpful with babies that reflux. Sometimes your pediatrician might talk about thickening foods, trying different formulas. There are some specific formulas for babies that reflux, but those would be things that you could discuss with your pediatrician. Other factors as far as reflux go, family history is important. If mom, dad, older siblings all had terrible reflux, it's likely your baby's going to have terrible reflux. If nobody's had reflux, then your baby's a lot more likely to have it be a milder case and to resolve quicker. Most bad cases of reflux will still disappear at about 9 to 12 months of age. So if your baby's a happy spitter, we're growing, we're gaining weight, expect that it's going to continue to be an issue usually through most of that first year of life. A lot of times they'll outgrow quicker, but that's probably what you're in for. Those would be things to keep in mind as you look at your new baby that seems to have some reflux issues. Also note that some babies have reflux but don't actually spit up. So if you notice your baby choking and swallowing and kind of gagging and you can hear him swallowing hard, that can be a case of reflux, and sometimes can be really bad even though they're not actually spitting up. But again, the same things would apply if your baby's otherwise gaining weight well, it seems to be comfortable enough. We do the same things, elevate their head, try to do smaller feedings more often, talk to your pediatrician about other options.